Welcome to Health Focus. I'm your host, Dr. Scott. February is American Heart Month. Each year, 715,000 Americans have a heart attack and 600,000 die from heart disease. This is a very important subject, and we're very lucky to have with us today a special guest, Alicia Lowe, who has some special insights into this subject and who's involved with Western Health and who's referred to us by the American Heart Association. Welcome to Health Focus, Ms. Lowe.
Thank you, Dr. Scott. I'm happy to be here.
And may I call you Alicia?
You may.
Okay, great.
I prefer it.
That's wonderful. Tell us a little bit about what you do with Western Health and how you got into this field, and just, a little bit about your background.
Sure. So I am currently the Health and Wellness Manager for Western Health Advantage, and I work with our members and our community members on health initiatives. Also work with the American Heart Association in partnership trying to get the education out there as to how to live a healthy lifestyle. My background actually is from the fitness industry. I've worked in fitness since I was 15, so many, many years. I've done everything from be a yoga instructor, group fitness instructor, fitness trainer, and I received my degree, my undergrad in nutrition and my graduate degree in health psychology.
Well, that's fantastic. And I really think that as we look at Healthy Heart Month, it's so refreshing to look at it from the point of view of lifestyle instead of just from the point of view that we often have in medicine of interventions, taking somebody to the cath lab, having a procedure done to open the heart vessels, doing diagnostic studies. Isn't it better if we could really foster a healthy lifestyle so that people really don't need all that?
Absolutely, and I can tell you just from firsthand knowledge that I watched my father go through all of that over a period of about 25 years. And probably one of the main reasons that I got into health and wellness was because I saw my parents live a pretty poor, lifestyle in regards to health. Both smokers, both poor diets, high stress, and it was interesting to watch him have to go through all of those things that you just mentioned and a deteriorating quality of life because he wasn't living his best life and he wasn't doing the lifestyle things he could have been to stay healthy and stay out of the hospital.
I sometimes wonder when it comes to heart disease, looking at it as a physician, is the glass half empty or half full? Because on the one hand, heart disease has dropped off and become less of a public health hazard with more aggressive treatment of high cholesterol and with less smoking in society. Mm-hmm. On the other hand, nationwide, it's still the number one killer, isn't it? So we've got a lot of work still to do.
We still have a lot of work to do. I tend to think that the glass is half full because we do have just a lot more research out there. We know what needs to be done to help people decrease their risk of getting heart disease and other diseases. Really, it's just about helping people to now make those changes. Yes, we've come a long way with the pharmaceuticals that can help with certain aspects of the disease, but at the same time, if we can get those lifestyle changes implemented as well, perhaps they won't even need to take pharmaceuticals to control it. So, it's finding that balance between the two, and every individual is going to be different, have different circumstances. But definitely the numbers are coming down because of more awareness out there in our nation and in our community.
I like where you're going with this in terms of prevention, because many of the things that we do to prevent heart disease also prevent cancer. And for example, in about 22 states now, cancer is the number one cause of death. And it's not that cancer deaths have increased, it's that the decrease in heart attack rate has been greater and more dramatic than the decrease in cancer deaths. But the things we do to prevent cancer and heart disease, like encouraging people not to smoke, to exercise and so forth, they really overlap. Wouldn't you agree?
I absolutely agree. In my field, we call it lifestyle medicine. And, when we're looking at our diet, when we're looking at how much we move, when we're looking at our stress levels, basically keeping all of those things in balance and doing the things that we know we're supposed to be doing, which we'll talk about in a moment, through the American Heart Association, they have a great initiative called the Healthy for Good movement, and it's based on 4 pillars of eating smart, which is basically eating low-fat, non-processed foods, that your protein sources are lower in fat, and you stay away from sugar as much as possible. Also adding color, meaning let's get that produce in our bodies. Let's get all those different colors. All of the colors that you see when you walk into the grocery store produce aisle, those are all different nutrients being represented. So if we could eat a colorful diet of fruits and vegetables, we'll be getting a lot of nutrients that our bodies need in order to live and to grow and to rejuvenate. Also, moving more, 150 minutes of exercise, of moderate intensity exercise a week. However, that 150 minutes can be got in. Maybe it's 30 minutes a day, 5 days a week. Maybe it's 10 minutes 3 times a day, 5 days a week. Whatever you need to do to get in that moderate intensity activity, as well as moving around during the day, not just sitting. A lot of us have desk jobs. We're sitting 8 hours a day. Going and doing your 30 minutes after you've been sitting 8 hours a day doesn't really count either. You need to make sure you're getting up and getting movement. You're going to the bathroom. You're going to the drinking fountain. You're maybe taking a quick walk on your lunch break. And the final component for the Healthy for Good movement, the final pillar, is be well. And that is such an important part of a holistic view of health and wellness, is our mental and emotional health. So that incorporates making sure that we get enough sleep, making sure that our relationships are good and positive and joyful, making sure that our stress levels, stay low if possible. And even if our stress levels are high, maybe, finding some ways to take some breaks out of that stressful day and kind of finding more of a sense of resilience to get through each day. So the 4 pillars are really important when looking at the whole person, health and wellness, lifestyle factors. And what we try to do with Western Health Advantage and the American Heart Association is to help people to understand that just simple baby steps that you can take in each of those pillars can really make a world of difference in the long run.
So let's reiterate the 4. You have healthy eating, adding color to your diet, exercise, and a sense of stress reduction?
Yes, being well. Mm-hmm.
And these are formal pillars, in a sense, that were put together by the American Heart Association, but you're also adopting them through Western Health.
Yes, definitely, because they cover the spectrum of what a person will need to do to live a healthy lifestyle. And sometimes breaking it down can be less overwhelming to the member, to the consumer. Maybe they want to just be focusing on their eating more vegetables, and until they get that habit down, maybe they just want to focus on that. So then we can move on to, okay, let's start to get some more exercise. Let's get more activity. What can we do to get more activity in your day? Maybe they've got stressful things going on in their life, and it's hard to think about the nutrition component from day to day, or making sure they get their exercise in. So what kind of resources can we help them with to help get through a stressful time? Whether it's, an acute stressor that might be over in a day, or maybe it's more long term and might take a little bit more time. So again, just looking at people as a whole person, and helping with each lifestyle factor as they are opened to making those changes.
I think those are great. And also, the number of people living with heart disease is really a lot higher than many people appreciate, isn't it?
Yeah, it is quite high, and actually 1 in 4 deaths in the United States is attributed to some form of heart disease. So it is still the #1 killer of men and women in our nation. And not to mention also stroke, which is related to heart disease. Even though it's not the #1 killer, I want to say it's number 5, but it is #1 leading cause of disability. Right. So somebody could have a stroke and they may live through it, but then quality of life may be impacted because they aren't able to move or speak in the way that they were prior. So that's why it's really important to bring awareness to heart health and cardiovascular health, because the system is all connected, and all of
Right.
our blood vessels, all of our arteries, we want to keep them healthy and strong, and we do that through activity, through eating well, and keeping our stress levels low.
I totally agree. And again, although we discussed this earlier, there's such an overlap in terms of preventing disease, whether it be in cancer or due to heart disease or stroke. For example, if you treat high blood pressure and optimize it, you're cutting the risk of heart disease tremendously. But also, that's the number one risk factor for stroke.
Right.
And the latest guidelines actually are more strict than they used to be. We now like to see normal blood pressure be 130 for the upper number, 80 for the lower number, or lower. We used to say 140 over 90. So aggressive treatment of high blood pressure, for example, is critical for preventing both strokes and heart disease.
Right.
And also, when it comes to cancer, the healthy diet you describe is probably the same diet that most people would recommend to decrease the risk of some cancers,
Absolutely.
including colon cancer. So I think this is really very important. And I guess we should also point out, Alicia, that heart disease is not a single entity, right?
Right.
I mean, I realize you come at this perhaps more from the fitness and outreach and education perspective, but thinking about it as a physician, we have congenital heart diseases in little children, where lifestyle is not really the issue.
Right.
We have some inherited heart diseases that present in the teenage years. For example, thickening of the wall of the heart called hypertrophic cardiomyopathy. And teenage kids should be screened for that if they do sports. So part of education is just the importance of being screened for heart disease. Would you agree?
I would definitely agree. And yes,
Yeah.
there are 10 to 15 different types of heart disease.
Right.
But when we are talking about, heart attacks and stroke, we're talking about the type of heart disease that could perhaps be prevented by
Right.
reducing those risk factors.
So-
But definitely there are those types of heart disease that, like you said, are congenital or just kind of acute. They come up and have to be treated.
Right, we're talking about really coronary artery disease.
Right.
When the blood vessels that provide blood and oxygen to the heart muscle get blocked
Right.
by plaque and fatty deposits. And that's really what we mean when we talk about someone having a heart attack.
Right.
But obviously, people also have valvular heart disease and other conditions. But everything you said just makes perfect sense. And Alicia, another thing that I think is important is to detect early heart disease that might be asymptomatic. For example, now with sophisticated echocardiograms, where we look at the heart with sound waves, we can see something called, I don't want to get too technical about it, but left ventricular hypertrophy, or thickening of the heart wall. And that causes no symptoms at all, but it's a sign that the person is more at risk for heart failure. And of course, we have people who don't have coronary events, but who have congestive heart failure.
Right.
And it all comes back to the relevance of those four pillars, because everything you said makes perfect sense. I guess one thing I would ask about is, I would think even more important than some of those pillars, although it's hard to argue with them because they're excellent, I would think smoking cessation would be almost at the top on any list. However, I wonder if the reason that's not part of the four pillars is because of our success there. So few people smoke today. What do you think?
Yes, I believe that we have all, as a nation, done a great job getting the word out about the negative effects, basically, of smoking and what it can do to you, and the cancers and the heart disease and what it does to your body. And I believe that our national rate is now under 14% for smokers, and here in California, I believe it's even lower. So we're just doing a really good job getting that message out there. However, we have another battle that we're needing to start fighting, and that would be with the electronic cigarettes and the vaping. So with that, we've got this problem of aerosols and different chemicals being used in place of a tobacco cigarette. to get nicotine into the body, and then those are also, we're finding, causing a lot of problems. So the education still needs to be done, but we have done a great job in the last couple decades of getting the message out and getting people to stop smoking.
I couldn't agree more. And in fact, we've had a program on Health Focus on smoking cessation strategies. And we had a guest who came and explained what was going on at UC Davis. And yeah, the rate in California is down to about 11%. Nationwide, as you said, it's 14%. You're exactly right on. And thinking in terms of your father's heart disease and the World War II generation, I think the smoking percentage peaked right before the Surgeon General's report came out, or right after it. So the Surgeon General linked smoking to lung cancer in 1964. Smoking peaked in about 65. And at that time, it was close to 50% in men and not far behind in women.
Wow.
And the rate for lung cancer deaths then peaked about a generation later. So for men, I believe in 1990, and women in 2002. And we're seeing those rates finally come down. And of course, lung cancer is the #1 cause of cancer death. So yeah, I think smoking cessation is terribly important. And we did talk about vaping as well on that occasion. And you know, I totally share your concern about that. That's so important. May I also ask you, do you have any activities or way of getting the word out about these important pillars? Is it mainly through the website, through pamphlets, or is there anything else
Sure,
going on?
yes, all of the above. So heart.org has all of the resources and all of the information on the Healthy for Good initiative. But there are also free resources that you can have, that you can order from the website. If you have like a school or a business that you want to get some information out to, and you want something you actually want to pass out. And then we also do events, you know, throughout the year on, you know, the different pillars. We have the Sacramento Heart Walk in September down at Land Park. We have Go Red coming up here in February, where we're just trying to continue to get the message out, get people involved in whatever we're doing for that particular event, and it's always a lot of fun. So yeah, so the website is a great place to go for that kind of information if you want to get, you know, print things out or order some resources.
That's the website for the American...
Yeah, heart.org, for the
Heart.org.
American Heart Association. Mm-hmm.
And Western Health, is Western Health primarily involved in providing medical care just in local regions, or is it throughout the Western states?
So Western Health Advantage, we're a local HMO. We're here in Northern California. That's kind of our territory. We haven't branched outside of California. But we pride ourselves on being local. We are very involved in the community. We do a lot of work just outside of health plan world, basically. And we have definitely branched out of Sacramento. So, you know, we are in Napa, Solano, Marin counties as well as YOLO. So yeah, we're getting our word out there and getting our members healthy and well.
You know, we talked about some of the tremendous accomplishments, obviously, in terms of smoking coming down, and also in terms of better treatments for heart disease. We didn't get into that too much, but obviously we now don't just rely on medications, but we have surgical procedures, and some of them are much less invasive than they used to be. For example, putting stents in the heart to open vessels and so forth. And that's all good news, but let's talk about some of the challenges we're facing. You mentioned exercise.
Mm-hmm.
I think really the extent to which we're becoming a sedentary society is troubling. I know here in Davis we have an active bicycle riding culture, and that's great. But I feel that, and this is just sort of my opinion from what I've seen, that with the advent of particularly cell phones and a lot of electronic devices, some of the lesser forms of exercise that we used to do, we no longer do. For example, opening a garage door. For example, going upstairs. And I think a lot of exercise doesn't have to be formal exercise. I think you alluded to that.
Yeah, definitely. Just being active, just moving more. And I think about that too when I'm at home with, the smart house. Everything is now voice controlled, and I don't have to get up to go turn on the thermostat. I can just do it from my phone. And I think about those things, and sometimes I don't want to be like that. I'll get up and I'll go turn up the thermostat, or if I need to change the TV channel, I can't get up anymore and change the channel. Everything is by remote. So we think about all these things that we used to do that would get us up off the couch that we're not doing anymore.
Right.
So now we have to be even more mindful to make sure that we get up and move. And for me, I got a puppy, and so I have to get up and take her out. Otherwise, she drives me crazy.
Yeah, I think those are great insights. And I'm kind of walking down memory lane here, so forgive me, but when I was growing up in the 1960s as a kid in elementary school, we walked everywhere and bicycle rode everywhere, including to and from school, and we played outside all over the neighborhood. And in my own case, with my own children, they've had almost none of that because we're so concerned about the possibility of something happening to them, like something untoward that might occur due to crime or whatever, that most people are so-called helicopter parents. And so our kids are very active in sports. My kids swim. They're teenagers now. In fact, my daughter swims for our college team, Pepperdine, so I'm proud of that. And my son swims for the Aqua Bears in Concord, so they're active on swim teams. But the days of kids just walking and going around outside are almost over because we're so protective of our children. And on the one hand, I understand that. On the other hand, I think it's a sad thing.
I absolutely agree with you. I think it's a sad thing too. And we were talking about my stepchildren prior to the show, and that is what I've seen with them, that they are so glued to their electronics and not wanting to walk anywhere. We live right across the street from a Target, and when they need things, they ask for a ride to Target. And I think to myself, it's right across the street. You can walk right over there, but that's not their culture. It's not what they've done. They don't walk places. They drive, or they're driven places. And I think that that's going to be a problem in the future for all of us. If everything becomes so convenient and automated, we're not going to be moving as much. So we have to be mindful to remember to move throughout our day, multiple times throughout our day.
Maybe on balance, it's a good thing because our children are precious to us and we don't want them wandering around through bad neighborhoods. So I do understand that. The other thing is the obesity epidemic. Now, that's one area where I think we have moved in the wrong direction. And is that something that you're interested in from the point of view? You mentioned diet, so obviously you are. But as you look to the future, I feel that that's a real challenge for us. How do you feel about it?
Absolutely. I think that's probably our biggest challenge because it's the obesity epidemic that is increasing the risk of all of these lifestyle diseases. So 2 in 3 adults now are considered overweight or obese in our country, and 1 in 3 children are considered overweight or obese in our country. So we're talking 2/3 of our population. Definitely we need to help people to understand that becoming overweight, becoming obese will significantly increase your risk of heart disease, diabetes, some cancers, and other problems. So, even in the workplace, if we can get people to adopt a culture, if we can get companies to adopt cultures of allowing their employees to be up and moving around, maybe they have a sit-stand desk, or maybe they have a treadmill desk. Those are kind of popular right now too. Or they're allowed to take more frequent breaks where they can actually get up and move about. And also making sure in the workplace or in your schools that you have access to healthy food, that it's not just a vending machine, that that people aren't always just bringing in donuts. So maybe they're bringing in apples, maybe they're bringing in celery with peanut butter. Think back to the snacks that we used to bring in kindergarten. They were always healthful snacks that we wanted our kids to have. So we definitely need to keep working on the obesity epidemic because that is going to help either help or hurt the risk of these chronic conditions.
Absolutely, and I'm glad you mentioned diabetes, Alicia, because obesity predisposes to diabetes, but diabetes is considered a major risk factor for heart disease.
Yeah.
If we look at the data from population studies, a famous one is Framingham. Obviously, advanced age predisposes to heart disease. Heart disease is more common in men. It tends to be more common in some ethnic groups. Smoking triples your risk of heart disease at least and increases your risk of lung cancer by 10 to 20-fold. And high cholesterol is a major risk factor. But obesity, although it's not a major risk factor, it predisposes to diabetes, which is a major risk factor.
Right.
And on the issue of children with diabetes, an interesting thing is that the majority of overweight or obese adults were not overweight as children, but the majority of children who become overweight or obese remain overweight.
Right.
So nipping it in the bud is important. And the pediatricians I've interacted with have said that it really should be a lifestyle issue. And getting back to your pillars, family dinners are important, where the meals are planned to some extent. It's hard when everybody's working and so forth, but I think that's important as opposed to everyone eating independently. What do you think?
I absolutely agree, and that's something that we do in our home as well, because it is the only one time during the day that you can bring everybody together, talk about your day. You have some control over what everybody's eating if you've planned a healthful meal. And it's a time to just kind of like let go of the stress of the day as well and know that you have a support system around you. So family mealtime is very important.
Alicia, Lowe, our time is running short, and I feel we're just scratching the surface here. But as we begin to wind down, I just want to ask you about sleeping. I think healthy sleep-wake habits are also very important. I think there are data that suggests that if we're sleep-deprived, we eat more. Would you agree?
Absolutely. Anything that will give us a sense of energy. If we're tired because we haven't slept well, then we think, oh, I want something to eat, I need some sugar, I need some caffeine, I need something to perk me up. But really what we needed was more sleep the night before. Sleep is so important, and adults should be getting at least 7 hours, 7 to 9 hours. I know for myself personally, 9 hours is probably perfect, but I probably don't get that just because of the lifestyle. I do get at least 8. But those days that, sleep is cut short, or my dog wakes me up in the middle of the night, or, I know many people have children and they have to get up, with their babies. But, it's really important that we set a sleep time, try to go to bed at the same time every night, get up at the same time every morning so that your body can get used to a rhythm and a routine. And then that way, hopefully, over time, you can sleep better.
Well, this has been a real treat. I feel I've learned a lot talking to you. I want to acknowledge not just your work with Western Health, but also the cooperation of the American Heart Association and Liam Connolly, who I believe helped to arrange to have you come in, and the work that you're doing together. It seems to be a very important partnership between both of your organizations. And I think, again, that the theme of prevention is so important, and it's consistent with what we try to do here on Health Focus to empower people. Do you have any closing thoughts or advice about people seeking more information? You mentioned websites.
Sure. So the American Heart Association has great resources on the Healthy for Good initiative. So that's theheart.org is the website. And also, just baby steps. A lot of times taking on lifestyle changes can be daunting. So I always just advise to just start small, start with something that you feel that is achievable, and then just work from there.
Start low and go slow and build up.
Yep.
Well, thank you. It's been really fantastic, and I hope you'll come back and visit us again on Health Focus,
Great.
Alicia.
Thank you, Dr. Scott.
Remember, here at Health Focus, we focus on your health, and all of us here in the studio wish you a very healthy and happy Heart Health Month, and look forward to seeing you back again. Take care. Thank you so much.